In today's Health Alerts, as we get ready to welcome the new year, there is something Michiganders should know. A highly contagious stomach bug is spreading more than usual this season. And I want to bring in our chief health editor, Dr. Partha Nandi, to break down the surge in cases and, most importantly, how to avoid getting sick. Dr. Nandi, welcome and tell us what we're dealing with here.
This stomach bug is no joke. As you know, it's super contagious. And one of my patients actually had 22 family members over for Christmas dinner. And within 2 days, get this, 16 of them got sick. Most had diarrhea, nausea, vomiting. Some even had severe abdominal or stomach cramps, fevers, and headaches. And all of these are common symptoms of norovirus. And norovirus is actually a group of viruses and one of the leading causes of gastroenteritis. And that's just a fancy word. Gastroenteritis is or inflammation of the stomach and intestines. Now, here in Michigan, the disease surveillance system recorded 1,395 cases of norovirus in 2024. That's higher than in the past 4 years. For the week of December 21st, 16 cases were reported. Nationally, the CDC tracked 91 cases during the week of December 5th, and that's more than double the highest weekly total recorded between 2021 and 24. So serious stuff. These numbers might not sound alarming to you, but remember that most people who get sick do not get medical help, so numbers may be higher. Symptoms generally improve, however, within 1 to 3 days.
Okay, Doc, let's talk about this. How does norovirus spread, and what, most importantly, can people do to avoid it?
It's an important question, right, Simon? So the most common way norovirus spreads is through direct contact with someone who's infected. You can also catch it by touching contaminated surfaces like doorknobs, countertops, utensils, and then doing this, touching your mouth. Another big source is food. If someone with norovirus handles food or drinks without washing their hands properly, well, then it can spread to others. Now, many folks call norovirus the stomach flu. However, it's not related to influenza and therefore cannot be treated with antibiotics, which only treat bacteria. Now, flu and cold medicines won't help either. So if you do get sick, what's really important is to stay hydrated. Since nausea and vomiting can cause your body to lose fluids. Severe dehydration can also sometimes require hospitalization to replenish fluids. The best way to protect yourself, in my opinion, is to really wash your hands thoroughly with soap and water for at least 20 seconds. This is especially important before eating or preparing food. Also, clean and disinfect surfaces that could be contaminated. Also rinse fruits and vegetables thoroughly before eating them, and cook seafood completely, since norovirus can spread through undercooked shellfish. And at the end of the evening, wash any towels or clothes in hot water. Getting sick with norovirus, absolutely is not a great way to start the new year. The bottom line is, if you have good hygiene, it's your best defense. We're hoping people who are watching can prevent some of these illnesses. It can really be quite incapacitating for a lot of people. And for people whose immune systems are down, and the elderly, can be even more serious than that.
Yeah, thank you, Doc. Simple steps that we can take to protect ourselves. I want to wish you a happy new year. And if you have a health question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or on X.